Hi, everybody. It's Dr. Gallus with Restore SD Plastic Surgery, ready for another edition of Carpools and Cannulas. In just a minute, I will have Dr. Greer with us, and we're going to talk about, let me just plug her in, go live. About insecurities, which I'm sure nobody has anything to say about. No one's ever insecure. All right, just waiting for her to hop on. There you are.
Hi.
Hey. See, we have matching buns today. My hair is
Yeah,
so disgusting right now. Oh, hey, Sylvia.
mine's mine's clean, but I was in the OR all day, so it's just
I was in the OR, so I was like, I'm not washing it. Yeah,
reasonable.
I
Reasonable.
know.
I actually hate washing my hair, by the way.
hmm I don't think it's good for your hair. That's what I've told
Yeah.
myself. Yeah.
Yeah. Yeah. I mean, I don't mind like showering. I just don't like wet hair.
No,
So,
exactly.
yeah.
Shower, not the hair. So yeah, I was just talking about how we're going to do things that women are commonly insecure about. Although when we were having
Yes.
a conversation, I was like, maybe we could it would be shorter if we just did things we aren't insecure about.
I
Because,
can't think of anything for that list, though.
right? The only, I still remember back in the 90s, do you know who Amber Valletta is? She was a model, not like a super model, but she's a very pretty model who tried to make it in acting. Anyway, it was like one of those interviews with her, and they asked her what was her least favorite thing about herself, like body wise. And she said her nail beds were unusually short.
Okay, now as someone who has the world's tiniest nails,
You do.
I do no, they're like
See,
they're
I
like
didn't. You're
no,
insecure
that's
about
the thing
that.
though. It's a real thing. Like I have the smallest nail beds. I've gone to get manicures and they're like, you have a little baby nail.
No design for you. No design for you.
There's nothing here. I mean, they're
Oh my
tiny.
God.
Oh
Oh
yeah.
God.
So I'm with Amber Valletta. But I do paint my nails now. I got over it. But yeah, no, I have like super short nail beds. It's a real thing to
I
be
just think
self-conscious about.
my nail beds would be like 337th on the list of things to be insecure about. It just
Well,
wouldn't be
but
about
you
ever.
probably don't have short nail beds though.
That's right. That's really my issue. I have amazing nail beds. They're very normal looking.
Oh yeah.
Um,
See, I mean, look at my little pinky nails. They're like babies. See?
God.
Yeah, you have great nail beds. They're really long. You can paint
Yeah.
them. I bet they look fantastic.
Yeah. So, well, speaking of things that women are commonly insecure about, I will say if you get out of the nail bed situation, hands
Right.
are, you show me your hands because mine are like, this is rejuvenated. So you have nice, youthful hands, and mine are pretty old. So they're not getting.
They look literally the same to me.
So I do feel like if women, like, it's not something that, unless you have unlimited budget, you generally spend money on. But I do feel like women are like, oh, I've done all this work to take care of myself. And then my hands are like, don't match my face or my neck or whatever. Right.
Yeah. And chest too. Chest is another like
Yeah.
once you notice it, once you see it, you can't unsee it, but a lot of people don't notice it. So it just kind of depends.
Yeah. Most people don't pay attention to that. Do you do any hand rejuvenation in your practice?
Actually, a fair amount because we do radius injection and then quite a bit of BBL.
Oh, okay. Yeah. So
Yeah,
yeah,
and we just got Mavachi too, so I'll probably try that on hands. That'll be fun.
radio frequency. Yeah.
Yeah.
We have we do radius. We also do a CO2 laser, fractionated
Yeah.
CO2 laser. We have the Aurora laser. And then I have tried, and it was trending, I've tried the Renuva fat transfer, not on my own hand.
Yeah,
Radius.
how was that?
It was okay. My patient was not totally thrilled. So I asked
Yeah.
Usha, a plastic surgery friend of ours in San Francisco, because she's quite a bit of experience with it. And she said that it might need a second round. But it's a little hard because I did 1.5 cc's in each hand. So that's like $3,000 in product. And then, yeah, we will talk about that in a second. And then 3 months later, it looks marginally better. And then you have to do that again. It should last forever. I would
Right.
say
But you got to
someone's
build it
asking
up.
least painful. I feel like the laser, if you numb the hands, you can do it without numbing. If you put a little numbing cream on, you don't feel it at all.
It's not
So
bad. Yeah.
it's easy. And then your skin's a little scratchy for a week or so, and then it's fine.
Yeah.
So,
BBL feels hot, but it
mhm.
doesn't last very long. And again, you can use numbing, so it's not bad. Like none of the hand rejuvenation methods are very painful, in my
And
opinion.
then using filler, I use Radius as well. Usually mix a little local anesthetic in there. So that is pretty painless.
Yeah. None
And
of them are bad.
you can do it with Lift, but I like Radius. I think it lasts longer for the hands. And Renuva didn't hurt either. You just numb up where you're going to stick the needle in and then drop it in with a cannula. But, and you can do fat in the hands too. You can use your own fat if you're so inclined and you're already asleep for something else generally. And you're putting fat somewhere. Why not throw it in the hands? So
Right.
Yep.
So that's one area.
So
And then there are lots of other areas that we're all commonly self-conscious.
What would you say is your most common, like, people like self-conscious about it?
I think the top.
Uh-oh, you're freezing up.
Oh,
I
that's
hope
why
it's
it keeps cutting
not.
in and out.
Okay.
Is it better?
You're back.
Okay, good. I would say either like breast asymmetry or sagginess, which
Who's Charles and Charles? I want to know. I love that.
No idea. That's an amazing
You
name.
remember that show? Okay, sorry.
No, but I remember the theme song. I never saw the show, but I know the theme song. Is that weird? Yeah, so breast asymmetry or general sag, because people have this misconception that breasts are perky always for all young women, and I can assure you from legit personal experience, they're just not. And then
young girls with large breasts.
Yeah,
There's a concept that aging breast is, saggy, deflated breast, but it doesn't necessarily have to be old at all.
No, you can be 20 and have breasts that look deflated, and that's normal. It's like nothing wrong. And then labiaplasty is another area where like every patient feels like they're the only person ever in the world to have this problem. And I'm like, no, I've seen 3 of you this week. It's very normal.
Right. I just saw something an hour ago. Yeah. Right. So, yeah, I would say those,
new senior executive.
Charles and Charles.
Nice.
All right. Well, we liked your candle. Labiaplasty is a common one because people will complain about their breasts. I guess not really in like at a cocktail party, but you're definitely not complaining about, labia issues at a cocktail party or even amongst your friends. So that is
no, unless you have a really close friend base, which.
So unless you're me at a cocktail party where people like drag me into a room to hold it. Yeah. Look at this. What do you think about this? Oh my God.
All of us. And they're like, is this normal? And you're like, I'll be at the bar.
I'm going to back out of the laundry room now. So I feel like with that situation, women are definitely, feel like they're the only one. It's that situation where like, I'm sure everybody else's labia are completely normal and I'm the first person to have this problem and it bothers me with clothes, with swimsuits. I feel uncomfortable in leggings. It's in the way. Or they have a significant asymmetry. Like you said, people always freak out when one side's not like the other side.
Yeah. And by the way, that's labia and breast too.
Yeah. Right.
Yeah.
Or
not just breast.
Eyes or anything. Everything's is asymmetrical from side to side. It's just different. It's on a, bell curve like most everything. So being able to reassure people that no, you're quite within that bell curve and it just depends on, whether it really bothers you or not. There's actually an article in ASJ that I saw today where they talk about it, like why it's so still like stigmatizing, or there's like a kind of a social pushback to women correcting that as opposed to correcting your nose or, adjusting your breast size or something like that. So
right, which is really interesting to me because as labiaplasty goes, it's a pretty low risk, very simple procedure.
Right. And you're you're not really doing it for everybody else to see. Like
Yeah,
that's
I
not
mean, most of the women I do either do it because they feel self-conscious or it's like literally like getting pinched and tugged.
right.
Yeah. If you ever want to see the like normal variation of labia, I found this one artist, I cannot remember her name or I would credit her, but she did plaster casts of hundreds of women's labia. And her homepage has like pictures of all the different ones. I used it for a labiaplasty post and credited her. But it's amazing to see just the huge variety. And obviously, it's not quite so good as actually looking at pictures, but it was a pretty amazing art project.
Cool.
Yeah.
So, okay, so that's two areas. What else can we cover that people are insecure about?
Cellulite, which drives me nuts because it's physiologic, it's normal.
Two things we suck at fixing: cellulite and stretch marks.
Oh, stretch marks. Everybody always asks me, they're like, do you have a fix for this? I would be a billionaire. Literally, I would be richer than Jeff Bezos if I could fix stretch marks.
For sure. So, do you want to explain what stretch marks are?
Yeah, so stretch marks happen when your skin actually tears in the dermal level. So it's thinned out and you can't fix that short of excising it. I still remember in med school rotating on plastics and we were doing a tummy tuck and the surgeon like flipped up the skin flap to show me the cross view. Like you could see where the skin was torn and thinned.
Right, right. Your dermis is like cut or incised, and then the epidermis, the top layer of the skin, is still intact, which is why it always looks thin and shiny and looks funky. And there's no way to put the dermis back together. Although we try to stimulate collagen in that area and maybe laser it to try and get the color pigment changes out. But yeah, you can put filler in it, but I don't recommend doing that because it looks funky. Yeah, so there's no good treatment for it, unfortunately. But it can happen with a growth spurt. It can happen with rapid weight loss. It most commonly happens with pregnancy.
Yeah, I actually got stretch marks, stomach, thighs, and lower back when I hit puberty and then didn't get any with pregnancy.
Oh, wow. Yeah. I remember getting a couple of my thighs when I grew as a growth spurt as a teen.
Yeah.
And I was
And I've seen guys get them on biceps when they start lifting really heavily.
100%. So yeah, you can get them anywhere. The most common ones we see are in pregnancy. Excision is the end all be all, meaning if you have them in the lower abdomen and you do a tummy tuck, they're going in the bucket, as one of the older general surgeons used to say. So, famously quoted at M&M, "The colon's in the bucket. What are we still talking about?" So, so the stretch marks would be gone, and then that would be the end of that. But other than that, there's no magic there.
There's only that.
There's a lot more options for treatment, but there's a new device out now, apparently, that I have not.
I saw that. I haven't tried it, and I never did Selfina, which have you ever? Yeah, it
seems
marks
2.0.
By the way, yeah. There's this one podcast I listen to, and whenever they have to explain something, it's like for their sister in Wisconsin who doesn't know anything about the business. I feel like we need that. So for my brother in Michigan,
Tracy.
yeah, Tracy. Oh, you listen to Smartlist too, and they're like for Tracy in Wisconsin. So like that. Anyways, cellulite is basically the little connections between the skin and the underlying muscle layer, and then your fat pushes on it, kind of like a button in upholstery. So the best way to treat them is to cut those little connections, and it's incredibly tedious. And that's what Selfina does. There's a new device on the market. There was also Quo last year, which seemed so brilliant. It's a collagenase, which breaks down collagen. It was initially marketed as Xiaflex for Dupuytren's contracture, which happens in the hand. And it seemed brilliant because it would dissolve the bands, but it apparently doesn't work all that well.
And create some bleeding and bruising that is semi-permanent. Like you can get bruising. So if you bruise easily and then the bruise stains the overlying skin, you can get like a permanent bruise essentially, which someone like my color would be at risk for. So somebody with any kind of ethnicity, Hispanic background, or black skin would be potentially in the danger zone for that. So I think there was a lot of like hoopla. And then the other thing is there's different, like, then you have to like analyze the cellulite. Is it really cellulite, or is it just your skin is like,
Heavy and you need a lift and there's some
yeah,
goopiness.
and
Yeah.
really, I don't know. Yes, I'm sure for really significant cases it might be helpful, but I don't know that the general like smooth out my skin, airbrush, make me look like a filter is there yet. Because there's entire industries based on lotions that will help improve the look of. So one of the things is one of my daughters has is it it's not sun bum cream. That's like its whole shtick is that it's supposed to like make your skin look better.
What does that have, like caffeine in it or something?
It must. So yeah, I feel like somebody else could like, I hope, remind us what it is. It comes in a cute packaging, like all Zoomers like, and I was like, you don't have cellulite, but she likes the way it smells. I mean, she's
Okay. I mean, like my 3-year-old has cellulite. It's not abnormal. It's not an aging thing. Like supermodels have cellulite. That's just the way your skin attaches to the muscles.
right, but it can be worsened with weight gain or loss,
Right.
I don't know. And it's usually a little bit genetic too.
True.
Yes, but those two things are and then I would say another thing men and women are insecure about are acne scars if you have those.
True.
And those can be treated, but it usually requires aggressive treatment to like really make them less visible.
Yeah, they're tricky. Even excising, sometimes they'll heal back indented. I've had that happen. And then you do laser treatments, but it takes like 8.
Mm-hmm. Yeah, it's multiple modalities is the most effective, but it's hard. So my PSA for that is to try not to have bad acne, which of course nobody can control that, but you can treat it aggressively up front instead of living with the scars later. Because once the acne is, and it's a bummer.
Well, I think Accutane was a game changer for that.
Absolutely. Yeah. I know. And back in the like 30s and 40s, they used to radiate people.
God. And then they'd all get skin cancer. Fantastic.
Yeah.
Yeah. Whenever somebody questions putting their kid on Accutane, I'm like, please do it. Acne scars are really hard to treat. And Accutane, you need a pregnancy test, but
right. And
it works
back too. So it's not not such a big deal.
Right.
Okay. Well, so we talked about hands. I would say another area that I think there aren't amazing solutions for as you get older, but another area is this like arm area, which I know it's freeze outside and I'm in San Diego, but I don't like being cold in my office or in the OR, so I'm always dressed like this. Anyway.
Okay, I'm wearing a sweater. It's 75. It's fine.
So anyway, so this under your arm area, like where it's loose or hangs, people
they hate it. And they're like, I just want the skin. I'm like, but you don't want a scar from your armpit to your elbow. And they're like, well, no.
Oh, no scar.
That's all I got. Yeah, that's it.
So, so I think in the right patient, liposuction can help a lot. And I do, when I liposuction the arm, I go all the way around, do a 360 arm. There are people who will just like lipo right here. But anyway, so I go all the way around, and I think the trauma of the liposuction also helps tighten the skin somewhat. And our colleague Megan Gruber also shown that also just offloading that weight too allows the skin
to shrink. Yeah. Now you have Renuvion, right? Do you use it in upper arms at all?
Yeah, and then I like to add a tightening device, so that would help too, to help tighten the skin. But there are limits. And it really, a younger patient that has more sub-Q and less skin is a better choice. But if you just have skin and you want to try and get some tightening, I've done it in older ladies with the Renuvion. We're not really taking any fat. It's just to look at the quality of your skin on the surface, because it's only tightening underneath. And so if the epidermis is a little crepey, that's not going to tighten either.
Yeah, I've tried dilute radiesse for that crepey epidermis. Meh.
I mean, you're stimulating collagen, but you're also aging at the same time. So I've done that above the knees. That's another, like, I'm insecure about what my knees look. People hate that. There is no great, so at least with the arms, if you really, really, really didn't like it, you could bite the bullet and go ahead and do an excision, right? And then that solves your problem and it hides well. So that's an option. But over the knees,
I mean, medial thigh lift a little bit, but that's a really long distance from the excision site. And the
yeah.
skin stretches, so it's tough.
Yeah, so I have actually successfully injected Radius in those areas and gotten a nice result. People were happy with the little crepey, wrinkly skin right up over the knee. But yeah, I've also had patients who I was operating on for something else, and then they pointed out that they had, I was like, oh, it doesn't look like a total knee replacement or a normal ortho incision. And they had somebody had tried to directly excise the skin above their knee, thought they could. I mean, it healed. It's just weird. And the problem. Yeah. So
it's like I saw a brow lift once that was like right here, kind of in the middle.
Yeah, you always wonder, like,
yeah,
what was going on there?
I don't know. You know, the other area here is like the crepiness here, but no one wants a neck lift, but they don't want the crepiness. I know. I don't have any magic tricks.
I've tried dilute radius there. And if you're trying to stave off surgery, then do all the things I do. Renuvion, I'll do radiofrequency microneedling. That being said, all these energy devices make it harder for a facelift later, but whatever. You can do dilute radius. I was not super excited about how that went. And then you can do some fillers and Botox and CO2 laser. You can just keep hitting it. Use a neck cream, use retinol, do everything you can to strengthen the skin. And I do think it's easier to work on the neck than, like, you know, if your arms, if you've been playing tennis or golfing your entire life, there's no rehabbing that skin in a short amount of time.
Yeah. Although here, like, I've had so many patients come and they just want something to treat the skin, but the underlying issue is like the platysmal muscle is just banding and heavy. And it's like, I'm not going to tighten your muscle with some retinol and a laser peel.
Not Rodan and Fields.
Yeah. No, those are magical. You just, the after pictures. You just
clip on the back of your neck.
Amazing.
It is amazing. Yeah. I think, isn't there a Nora Ephron book, I Hate My Neck, or something like that?
Is there? I don't know.
I think it's a common area. All right. So we've kind of hopped all over the body.
Yeah.
Nail beds to arms to I would say thighs, because we already talked about cellulite and the knees and
okay, you know what's one area that I will totally get self-conscious about when this happens, but no one else seems to notice it, is earlobes. Like, they get so big and they get kind of floppy. They grow. And I feel like when this happens to me, I'm going to be like resecting my earlobes in the office, but nobody else ever seems to notice their earlobes. Maybe because I'm a surgeon.
I've only had one patient ask me to fix it. Unless you have those giant plugs. But yeah, like an aging earlobe, you're right. People do not get up in arms about that.
I notice it on everyone. They don't notice it, so I don't bring it up. I mean, or a jerk.
It's a more of a practical problem, like if your earlobe piercing stretched out and that's dragging it down, people will complain about that for sure.
Yeah, and I fix a lot of piercings, or if they're just, your earlobes do lose volume as you age, and a little filler really helps. I do filler in my earlobes to keep my earrings straight. But now I have a nose ring, so as that ages, I guess I'll have to do a little nose filler.
No, it's not gonna. I had a nose ring, so that's not gonna work. You take it out, and you'll just have an extremely large pore.
It'll be beautiful, and then I'll size it. But I just got it like 2 weeks ago, so
it's cute. I thought I noticed it while you were lecturing.
Yeah, on the WPS lecture, I'm like, I got a new tattoo and a nose ring. I had a weekend away with my high school bestie, and we had a great time. Mm-hmm.
OMG, where did you
so fun.
Are you going to tell us about your tattoo?
Oh yeah, of course. And by the way, full disclosure, this is my midlife crisis because I'm getting divorced, nose ring, everything. I have another tattoo scheduled for next week, and I'm going to get a needle driver right here. Like, I drew it out. It's a loaded needle driver with suture in it. That's what we use to suture. I'm excited. I also have a 10-blade scalpel, like on the rounds handle, drawn out for later. But so here's my new tattoo.
Oh, wow.
Yeah, it's a compass, because I realized very conveniently I named my kids Wyatt, Ella, and Sawyer, so they're all compass points. But the south arrow has 3 arrows here, and that's the Down syndrome tattoo, because Sawyer has Down syndrome. So,
oh, wow.
Yeah.
It's fun. Meaningful.
It
I love
is.
that. Yeah. But then you're going to do a needle driver with suture?
Yeah.
Where are you putting that, on the other
I'm
arm?
gonna put that. Yeah, I'm gonna put that on the inside of my bicep, and then maybe when I get the scalpel, it'll be like outside arm here. I totally
When are
expected
you
my
moving
mom.
to California? Because you
I
did
don't
it.
know. I could. It's okay. My boyfriend's down with it. He's got arm tats. It's great.
That's
I totally expected my mom to freak out, even though I'm 41 and a half, and she was just like, okay, whatever.
whatever. It's all you.
Yeah, you're an adult
No,
now.
that's
Good
great.
luck.
I just can't decide. I saw somebody, and I mean, I practice yoga, so I see a lot of tattoos in the studio. And one girl just had one, and it was just in a cool font, and it just said "sane," and I just thought that was the best.
Nice.
I would love that.
Oh, I love. I have
Sane.
a patient in
Or
her
nope.
early. Oh, nope, it's good. I have a patient in her early 70s who just came in with like a full shoulder. It was like a vining flower. It looked amazing. She's got her legs done. I'm like, yeah,
Okay, you go, girl.
go.
That's awesome.
Yeah,
Very fun.
it is. I don't remove tattoos, but I'll get them.
Yeah, so the nose piercing, I don't think you'll need filler there. It is a hole that I don't think closes up, though. And I've seen, again, Southern California, there's, yeah, that's true. When I was in the military and we would do our pre-op conference, all of my patients, like we present, 3 or 4 breast reductions for the week. And my patient would be the one that was like tatted to the max. I mean, I've seen everything. The guys for gynecomastia, like you couldn't even find their chest because it was just all big tats. Girls with like pistols on their chest. I mean, some crazy stuff.
I am noticing now that I got, and this is not my first tattoo. The other one just doesn't show, but like so many of my patients have tattoos and nose piercings, and nobody cares.
No, not at all. Like I said,
Yeah, it used to matter. Like a doc with a nose ring when I was in med school was kind of a big deal.
Yeah,
I'm obviously old. Yeah.
yeah, I know, I know. Yeah, no, I've seen that. I feel like somebody asked on like there's like a women's physicians group for like there's 1,000 of them, but one of these, somebody asked if it was appropriate to wear multiple earrings in her ear in clinic, and people were like
this one and
people
this
are
one
like,
and
oh,
this
the
one.
14, I have 12 in one ear. It was funny.
Yeah, it's just like not the thing anymore.
We're like, who told you that was unacceptable? I'd wear more if I wasn't so lazy.
Seriously. Ooh, planning incisions or in tattoo designs. Great question. So
Yeah.
actually, no, I put the incisions in the same place. The key is to line the tattoo up really well. And it doesn't show.
And if it's possible, like if it's a lower abdomen tattoo and it could possibly get it removed with like a tummy tuck per se, then we'll ask and say, hey, you want this out or in? Because you can kind of design around it.
Yeah, I did have a patient entire abdomen tattooed. It was a cover up of a cover up. It was a giant fish. And I was really happy with how the belly button inset worked because there was like a little ink left on the belly button and it blended really well with where the tattoo moved down. I mean, that's something I really look at when I close.
Right. You definitely take it into consideration to make sure that it's not going to look insane or that they're going to be able to work with it.
I'll be getting all the surgical instruments tattooed. And by the time I'm like presenting at PSTM, plastic surgery, the meeting, in like 10 years, it's just going to be like a full
sleeve of surgical instruments.
It'll be great. Yeah. And like with some flowers mixed in, maybe.
I mean, a theme's a good idea. I love a theme if you're going to do
it's fun, right?
Like that. I never could settle on anything. I have a tattoo also in a place you can't like show on Instagram Live, but it was a cover up of it, like you said it, and it's like half lasered off and whatever. I was going to move down, getting to more, and then I knew that was going to be a rabbit hole that I wasn't going to. Hence, same with the piercings, same with everything.
You start getting one and you're like
facial piercings though, because those leave holes in your face as well.
I mean, we can excise the hole; it will leave a scar. But and then the dermals where they're embedded, those for surgery, we always like people to take out their piercings, but the dermals they can't. So
I'm thinking that's an old wives' tale, though. You can just tape them.
I know. I've never seen one arc. I will have patients take out nipple rings for breast dogs, obviously, or put them, like they'll change them out with glass, which is non-conductive.
Yep. But all right, well, we got way off topic, but that's cool.
As we do. But, you know, I got to show off the
new piercing. And
thing.
speaking of off topic, your talk was great for the
Oh,
webinar series.
thank you.
Yeah,
That was so much fun.
so amazing. I was on, I don't know, some other conference call for our National Society for ASPS. And oh, I know. I was like, I've already blocked it out. I was on the nominating committee. And so we were interviewing international representatives to the board. And I think 2 out of 3 said that they appreciated the webinars. And I didn't really understand that, like, webinars presented by WPS, by Plastic Surgery, the meeting, it's like easily accessible for international plastic surgeons.
Oh,
like,
yeah.
They thought that they were great. And I was like, oh, can somebody like write that down? Like, is everybody listening? Because they 100%, this woman from Australia mentioned the WPS webinar series. And I
mean, I loved getting to hear Dr. McLennan present on her tuberous breast. I'm taking screenshots of her video for notes. And then, Dr. Gordon's technique for breast aug revisions. I mean, I learned as much on those. They were fantastic.
Yeah, they were all really high quality. So, but it was good to see you on Instagram Live.
Thanks. And I can't believe I was texting you the whole time. I'm like, did you see my 8-year-old walking behind me shirtless? No. He totally did. He like came up behind me and he's whispering in my ear while I'm presenting. I'm like, go put on a shirt.
I guess we're all like focused on the plot. So
yep.
Thing. Okay, cool. So if anybody has ideas, DM us for a suggestion for our next sesh. We'll come up with
I mean, I suppose we could talk about like piercing repairs and tattoo removals. That's one we haven't talked about.
We could do that.
Yeah.
Let's do it. All right.
2 weeks.
Bye, everybody. Thanks for joining us.